everyone, and welcome to our stream today. October is National Depression and Mental Health Screening Month. Today is October 1st, and we're going to be talking about all kinds of things related to National Depression, to depression and mental health screening, and also World Mental Health Month is in October. I'd like to welcome Dr. Christine Kalmus and Dr. Paula Smith-Benson, and we are going to get started with talking about mental health screening month, mental health screening, and why it's so important that people approach their mental health the same way they approach their physical health. So, welcome, Dr. Smith Benson and Dr. Kalmus.
Hi, I am the Military Sexual Trauma Coordinator for VA Maryland Healthcare System. And Dr. Paula Smith-Benson is a peer specialist with vocational rehabilitation services. We are so excited to be here for the second time to continue our discussion of Paula's mental health recovery experience.
Yes. Hi, everyone. Thank you so much. Welcome back. We're so happy to be here this afternoon to continue the conversation. So we are just grateful for this platform. So we're just going to have a
grateful that you're here. So let's talk about depression and mental health and why screening is important.
Mm-hmm. Well, screening is very important because depression is very common. Many people will experience an episode of depression at some point in their life. And a lot of the symptoms could overlap even with physical health concerns, things like changes in sleep and eating, feeling really agitated, or the opposite, feeling really slowed down, weighed down, loss of interest in doing things. It's really important that people screen for depression and learn more about what makes up an episode of depression. It's far more than just being sad. We're also on the heels of Suicide Prevention Month, which was in September. And suicidal thoughts are a very common part of depression as well. When things get bad, people can feel like their life is not worth living, even have thoughts of killing themselves. I am hoping that Paula would be willing to share a little bit about a time in her life when she had suicidal thoughts.
Yes, absolutely. And I'm grateful for the opportunity. And it all ties together. First, I want to say that in terms of screening for me for depression, my depression screening actually occurred in the primary care clinic.
Yes.
Because I was experiencing trouble sleeping and I just thought I was having some insomnia. And interestingly enough, my mother had just passed away. So I was grieving the loss of my mother, and my assumption was that the symptoms I was experiencing were grief related. But what happened is that the symptoms were what you call protracted. I did not bounce back. So I did experience a sadness and a sense of hopelessness, helplessness, and the screening occurred in primary care. So I just want to put that out there. One place of accessing care is primary care. So if there are any veterans out there that are having any concerns, please utilize your primary care providers because they're a gateway to get the help and the support that you need. Exactly. So in terms of suicidal thoughts for me, they didn't happen all at once. And I must say that I was very, very, very embarrassed, and I felt a lot of shame on the inside because I had these thoughts of just not waking up. And it all started with, it would probably be better off if I just didn't wake up. Or my family would probably be, a lot less burdened if I just wasn't here. So it wasn't anything directly, But it was this sense of maybe I should leave, maybe I should transition, maybe I should take my own life. And those thoughts kept coming. I thought that I could handle it, or I could press through, push through, soldier on, all of those things. The military core values came back: integrity, excellence, service. So I just kept going, kept going. And I needed help.
Mhm.
This was something that I could not manage, nor could I handle on my own. So I went into the primary care, and I didn't tell them that I was having suicidal thoughts because I was embarrassed. But I did explain to them about the helplessness and the hopelessness. I do want to say this: I never wanted to die. I
Mhm.
always wanted to live. I just didn't want to live like that.
Yes.
I was experiencing a degree of emotional pain. The only way I can describe it to you is that my soul hurt, my
Mhm.
very being. The essence of who I was in excruciating pain. I didn't even have words to tell anyone or describe what was happening to me. And I thought I was alone.
Mhm.
So that's how the suicidal thoughts came up for me. I do want to say that I did attempt suicide in 2014. I actively tried to take my own life. I am so grateful that I'm still here and I'm still living. But at that moment, Christine, I just didn't see any light at the end of the tunnel.
Mhm. And I really appreciate you sharing that, Paula, especially the transition of symptoms. Like you described, this didn't all start at once, right? And what can happen with those thoughts, like, maybe I shouldn't be here, maybe it'd be better for everyone if I didn't wake up, is they can progress into thoughts of actually taking your own life. One resource that we have available that is so important for our veterans is the Veteran Crisis Line. Have you used the Veteran Crisis Line in the past?
Absolutely. I use the Veteran Crisis Line multiple times. And
Mhm.
I'm not ashamed to say that the last time I used the Veterans Crisis Line was June of this year.
Mhm.
So, the Veteran Crisis Line is a national 24-hour a day, 365 days a year access point for veterans to get help. The number is 988, and for veterans, you can press option 1. So, the Veterans Crisis Line, I was having these suicidal thoughts, and I was thinking, well, maybe I can just talk to somebody. And
Right.
the thing about the Veterans Crisis Line is it's a judgment-free zone. No one's going to judge you. So when I called, I knew that there would be someone on the line that would be present, that would hear. I knew that there would be someone on the line that was not judgmental and would be actively listening, and that they could connect me to resources. So at that particular time, it could have been I needed to connect with my provider. Perhaps I needed to go in the hospital. And when
Mhm.
I called the crisis line several years back, the determination was, I think that you need to go into the hospital. And
Mhm.
that's exactly what I did. So
Excellent.
I took myself to the emergency room, let them know that I was having these suicidal thoughts, and I didn't feel safe.
Yeah.
I did not feel safe. And they admitted me to the hospital. And I went to the acute unit to receive treatment. And I'm so thankful for that, because I would not be here if it
Right.
wasn't for Veterans Health Administration and having those options for care. And sometimes that's the care that's needed. And for me, that's exactly what I needed at the time.
Mhm. What
So
type of
I do have
care?
a
Oh,
question. Paula, you said that your mom had died and you were grieving your mom. With the number of people who have relatives who passed from COVID, and it seems like these years of are the great exodus where a lot of people are dying of all years. How do you distinguish? And maybe this is like, how did you know that you were, like, where does grief end and depression begin? Like, how do you know when to seek help? You use the word protracted. What does
Mhm.
that mean? And how does one go from I'm grieving or mourning someone to I need help? Like, where is that continuum? Where does someone say, "Oh, I can't do this"? Like, where does that
Mhm.
help? Where does grief end and depression begin?
Thank you
So,
so much. That's an excellent question. I'm glad we have an opportunity to talk about it, and I really want to hear from Christine after I share this point. So I actually did not. I was not able to distinguish the line. So I can't tell you when I actually crossed over. However, I can tell you what happened. I was on my way to work. I worked about 10 minutes from home. I was active duty at the time. Two exits down on the interstate. So I would get on the interstate, go two exit down, get off, and be at work. Well, I left out of the house that day and I was disoriented.
Mhm.
I couldn't remember my name. I couldn't
Wow.
remember my social security number. I could not remember my phone number or any particulars about myself. I could not find my way to work. I ended up 100 miles away from work. Every exit I got to, I said, I think this is the exit, but nope, that's not it. It doesn't look familiar. So I'm just driving and driving and driving. I think this is called dissociation. So Dr. Kalmus is going to come in and help us out with this. But I totally lost touch with what was real for me.
Mhm.
And that's when I knew something ain't right. You
Right.
can't do this on your own. I'm 100 miles away. I didn't even know how to call for help. When I finally got to the 100 miles, whatever I was experiencing, it broke long enough for me to know that I could remember my name, my phone number, and I could call for help. And I ended up calling my spouse at the time, and they came to get me and brought me back home. At that point, I had to ask for some help. And what I meant by protracted is that I've lost family members, loved ones, and friends in the past, and there was a pattern to the grief. And this was going on and on and on. And the difference for me, I can't speak for anyone else's experience, but this thing that I was having that I couldn't quite figure out was affecting my life.
Yeah.
My work was affected. My relationships were affected. My job was affected. Help me out, Christine. But for me, that was the difference for me. Those areas of my life started to break down.
Right. And I think for a lot of people, it is about the length of time and the intensity of the experience, right? So something that goes on for months and months and months, and that is impacting important areas of your life, like you described, Paula, like your relationships, your work. That's something that's probably could require some intervention or attention, right?
Mhm.
There isn't a clear cut kind of distinction always between the two, which is why it does not hurt to ask for an assessment if you're struggling with grief for more than, you know, several months and it's really impacting your life. The experience that you had in, the car and driving to work sounds like a very extreme case of a form of dissociation.
Mhm.
um, and certainly something like that is not all that common at that level of intensity. And it's certainly something that would warrant some type of intervention and assessment. So I'm really glad that you were able to get that, Paula.
Absolutely. And thank you too, Christina, because you're absolutely correct. The intensity is critical. And
Right.
my mother passed away January of, no, excuse me. My mother passed away August of 2000. This incident occurred in the following year maybe March, April timeframe.
Mm,
So this grieving experience lasted a very, very, very long time.
time.
Right.
Yes.
It was a long time. And I just couldn't bounce back.
Right.
And I realized at that point, I think they diagnosed me with major depressive disorder, moderate.
Mm-hmm.
So because I was not able to take courage, let me tell you something. It takes courage and bravery to ask for help,
It does.
no
Absolutely.
matter what it is, but particularly to ask for mental health assistance because there's such a stigma out there in society. And especially around military and veterans, there is a stigma. And
Definitely.
what is stigma? Stigma is a negative attitude, a negative mindset towards a particular thing. So, because of that stigma that was in the outside world, I internalized that same negativity and started feeling bad about myself as a person.
Mm-hmm.
So, part of the suicidality, the suicidal thoughts, was the stigma too
Mm-hmm.
on top of everything else. It was a barrier. And stigma is a barrier to accessing care. You won't come
Absolutely.
in if you feel bad about yourself.
Mm-hmm.
So, yeah.
Which just makes things worse and is really an important reason why these type of outreach events are important, because they open up the lines of communication. People start to hear things that, make them realize that they're not alone. Because these experiences that we're talking about, especially something like depression, is actually very common, very. And yet it's something that people don't always feel comfortable talking about because of stigma. So again, if we realize how many other people have had the experience, it helps us feel less alone. It helps us feel less shameful and able to access care.
Absolutely. And I must reiterate for the active duty folks that may be out there watching, this occurred while I was on active duty. So that's even scarier because it's the stigma, but it's also this notion of being unfit, not being fit to serve, not being fit for duty, not carrying your weight, not being able to do what the mission called for you to do. And at that time, I was working as a nurse midwife. So I had responsibilities and things that were required of me. I had a team of people that were depending upon me. So there was a lot of pressure to be quote unquote perfect. So I had to fight through all of those mindsets, those thoughts, those ideas, press past the stigma, the shame, the embarrassment, and then ask for help. That was probably one of the most difficult things I've ever had to do. And then to come out of there with a diagnosis and have to process what that feels like. This has not been an easy journey, but if it brought me to this seat, then what I will say is it's absolutely worth it. And I hope that someone out here knows that you're not alone. Right now in this moment, we see you, we hear you. Your life absolutely matters, which is why we're here, to let you know that here at the VA Maryland healthcare system, we're both employees. We are happy to serve you. And it's a host of people that are here to help you and support you through wherever you are in the journey. And that really is the take-home message. We want to break down those barriers. We want to take stigma and confront it with what's true. And then begin to create an environment where someone could say, well, maybe I can get some help, because you absolutely can. And we do recover. We recover every day.
Right.
So, yeah.
So one of the things that I want to, you had enough wherewithal or self-awareness to know that something was wrong. What about those veterans out there who may not have that self-awareness, but their family members are very aware? So, what do you want to tell family members out there whose veteran is acting a little off? Describe what the offness might be and describe what family members and friends and loved ones can do when they notice someone like feel looking depressed, acting depressed, maybe without even saying it, maybe harboring suicidal ideation, but not saying anything to anybody. So, what do you want family members to know?
So, what I would say to family members is first and foremost, thank you. Thank you, thank you, and thank you. We definitely cannot do this without our family members, friends, community, support system, and loved ones. So, what I would say to family members is number one, get educated, familiarize yourself with what is a mental health challenge. How do you equip yourself? What do things look like? So, two things are popping in my head right now. The first thing that's coming up, if there's any family members that are out there that may need assistance, there is an organization called NAMI, NAMI, the National Association of I can't remember the
Mental illness. It's National Alliance of Mental Illness.
Thank you, Dr. Kalmus. The National Alliance for Mental Illness. That organization is a peer-led organization that's been around for decades. They're doing amazing work. But what's important to me to share is they have a lot of support for family members.
They do.
They have groups for family members. They have training for family members. They have a community specifically for family members. So number one, make sure that you have the information and you're equipped with what you need. Number two, connect to a community organization that can provide you with additional support. Number three, self-care, self-care, self-care. We cannot pour from an empty cup as a family member. So we have to keep our cups filled, taking good care of ourselves before we can even go out and assist a veteran. So the other thing is that depending, I can't make a general statement. I'll speak from my own experience. In my experience, one of the areas that actually started breaking down was relationships. So that interpersonal connection started to actually disconnect. So perhaps some things that you could look for, which may not be diagnostic, but it may let you know you need to connect a little bit more, might be isolation. Perhaps maybe not talking as much. Maybe mail is not getting opened, and maybe things that would normally, text messages may not be getting answered. Phone calls may not be picked up. Those are some things that you may observe, just maybe a difference in how the individual relates to others. And what I would say is, again, make sure you are at your highest and best self so that you can take care of yourself and to support the veteran. But to your point, Rosalia, it's hard to say, because I'm gonna say this. What Christine said was critical. It's the duration and the intensity. There are days that I feel sad. That's not depression.
No.
That's sadness. So sometimes our full range of emotions can be misinterpreted. So it's the intensity and it's the duration. So just kind of keep an eye out, and then approach the situation gently and lovingly. The best gift that you can give is the gift of your very presence and listening to get an understanding of the individual and just to be present. That's what I would say. Support yourself, care for yourself, and just show up for the veteran.
Does and Christine, this is for you. Does the VA have a program that helps family members connect their veterans to care, like a coaching into care or a connecting veterans into care?
I believe that there is one, but I'm not real familiar with it, to be honest with you. But that is something, actually, it may be called coaching into care. So that would be something to look into. I also think that it's important to ask the person what you can do to be most supportive during this time. And then, try to honor what they say.
Mm-hmm.
So I saw some articles that talked about the myths of suicide. So Paula, did anyone ever say to you, are you having are you thinking of suicide while you were in that state? Did anyone ever confront you with it? And do you think that would have helped if you were so embarrassed? Do you think it would have helped if somebody would have broken that ice and said, hey, are you thinking about suicide?
That's a great question. So I had a mask on. So no one even knew I was having a problem. I had a complete mask. You wouldn't even know that I was experiencing any symptom, having any problem. So no one ever approached me because nothing looked different. So no one's ever asked that particular question. Had they asked the question, I may not have been able to answer it at that time. However, that would have let me know that this may be a safe person. This may be someone that I can connect with in a non-judgmental way. So here's something that I use to help myself, to just test the waters. Because it's sometimes you want to tell your story or you want to share something, but you're not quite sure if that person is the right person. So here's what I do. I don't know if anyone's ever watched a show, and I believe that it's I think it's CSI. There's one of the common shows, and the individual has a mental health challenge, and his mother had a mental health challenge too. So sometimes I will approach people and ask questions, just general questions. Have you seen that episode of whatever the show is? And that person had a mental health diagnosis. Well, what do you think about that? Did you see that episode? Or if there's something going on in the news or in community, that's how I kind of put feelers out just to see where people's perceptions are. And it lets me know if that's a person that I can actually go to, or maybe it's a person that may not be ready to have the conversation. So
I
there's
love that. That's a great idea.
Yeah. And it's non-threatening. No one even really knows. It's just a general conversation. But if they say, oh yeah, that guy was like totally nuts, then that tells me, that's stigmatizing language. So that's not the person that I might want to open up to. I might want to observe a little longer and see if it's going to be comfortable for me.
So Christine, do you have any other questions that you want to ask Paula about her experiences? Because I would like to get into the area of how VA actually helps veterans. Like, what do we do when people come and they're in crisis, or maybe not in crisis, but just, is there something called a low level depression? I mean, is that even a thing?
Absolutely there is. So I think that this would be a good time to transition into how to connect with mental health services. So certainly if you're having a crisis, we would want you to go to the emergency room or call the Veteran Crisis Line. And generally, after an evaluation in the emergency room, they will come up with a plan of care, whether it be a hospitalization or getting you connected with an appointment in the mental health clinic. Generally, another way of connecting is asking your primary care provider to connect you with mental health. There is something at VA Maryland called the Mental Health Triage Clinic. And this is for people who've not previously been connected with mental health or have not seen anyone in mental health for over a year. It's an initial appointment with a provider where they collect a lot of information about current symptoms and treatment history so that they can recommend the best program for you within our system moving forward for more specialized care. So those would be some good ways to get connected.
Is that triage a walk-in? Can people just walk in, or do they need an appointment?
I don't know if it's walk-in anymore, but I believe that they can schedule appointments very quickly.
Mm-hmm.
If they don't do same day or walk-in, you could call there and schedule something pretty quickly.
So once somebody actually is connected to care, then what is the next step? What can veterans expect?
Yeah,
how can they expect to be treated? Like, how will they be treated once they have come in?
Yeah, that's a great question. And I think it really depends upon the person, their needs, and their preferences. So some people just prefer medication. They may meet with a medication prescriber. Others don't want medication, and they may meet with an individual therapist. There are a lot of different group therapies also. And certainly people could do a combination of these, individual and group therapy along with medication. Other people kind of warrant more intensive services at a residential or inpatient level.
And can you talk a little bit about our residential and inpatient facilities? I know we have some at Perry Point, which are residential. Mm-hmm. And what is the difference between residential and inpatient? Like, for people like me who are not medical people or clinicians, like, what's the difference?
That's an excellent question. Residential would involve in a more intensive program where you stay there in a building at the hospital, but unlike inpatient, you can come and go. You're not sort of confined to one unit or area or space. There are rules about when you need to report in, when you need to be back for the night. You can even leave campus. There's rules related to that for residential, but there's much more freedom to come and go and move about with residential than there is with inpatient. Inpatient is much more intense. The goal is to make sure that the person remains safe and is not a threat to themselves or anyone else. So they are on a locked unit for a period of time.
Mm-hmm. Yeah, absolutely. May I add something?
Of course.
Yeah, so I wanted to also just say, and thank you so much, Christine. You did an excellent job kind of summing up it, because it's very comprehensive. I mean, we really provide a wide range of support. And currently at the VA Maryland, I serve as a peer specialist, and I'm really proud of that role. It's probably one of the most important things that I've ever done. And a peer specialist is actually a member of the healthcare team. So we're a part of either the primary care team or the mental health team. And we are veterans. All of us are veterans. There are about 1,400 of us across the VA nationwide. And we have about 12 of us that are here across VA Maryland. And what we do every day is we show up as evidence that recovery is absolutely possible. So our role is to use our lived experience to support other veterans that are working through their recovery experience. So we leverage the strength of our camaraderie and just the common ground we have as former service members. We share resources and tools that we've used within the VA system that have been helpful. And then we're there to be a support. So I'm very grateful. The VA is really leading the way in terms of integrating peer support services into the mental health departments.
So that sounds like a very good reasons for veterans who are not connected with the VA healthcare, Veterans Health Administration, or in Maryland, the VA healthcare system, to become connected because here they will be able to get the treatment that they need to recover.
Absolutely.
So let's, Christine, is there a screening for depression? Like, how's depression diagnosed?
Yeah, there is a screening, both in primary care as well as mental health. And the level of screening really varies, I think, depending upon the setting. But there absolutely are screenings.
So let's talk about World Mental Health Month. Why is this important? Like, we know that veterans, we know that veterans have suffered trauma, especially from combat or just from simply being in the military. That might be considered an extended and long trauma for some people. We also know that many people have lost loved ones. There's a lot of grief in the world today. So, talk about trauma and mental health and why, mental health month is important in that regard.
I think it's important for all the reasons that I mentioned before and that Paula mentioned about combating stigma and to letting other people know that this is something that is not that uncommon and that is okay and good to talk about. So that people know that they're not alone. People become aware of what resources are available and how to access them. All of those sorts of things.
Absolutely. Thank you. That was great. It really is about raising awareness. Now, I can say that growing up, honestly, I don't recall anyone talking about mental health. I don't really recall anybody talking about mental illness. It was just sort of just not discussed.
Yeah.
So what's beautiful about this is that we have the opportunity to not, like, our conversation has really been about just an individual experience, but we're really talking about social change, transforming communities, and now we're talking about transforming the globe. So why this is important? Because the focus is mental health and well-being. And what does that mean? How do you get to wholeness? What does well-being mean for the individual? But what we know is that we're all interconnected in this world. So when one aspect of this huge system gets better, guess what happens to the world? The world gets healthier. So I think that's why it's so important. And I'm grateful that this is a global effort. Like, we're standing up all over the world to just be advocates for resilience and advocates for self-care and advocates for really mental well-being, because we are body and we are mind and we are body. We're all connected. It's all integrated. So I'm just grateful for the opportunity to raise the awareness and, like Dr. Kalman said, to break down the stigma.
So, what are some positive things that you want to leave our veterans with if they think they're struggling with the mental health issue, whether it's depression or some trauma related, like PTSD, or what do you want them to know more than anything?
More than anything, I'm going to lean in for this one.
Yes, please.
I'm leaning in. You are not alone. That is the message that I want to leave with you. The VA Maryland healthcare system, the entire system is rooting for you. We're rooting for you. Your life matters. Your life matters. Your wellness matters. Your recovery matters. And we recognize that it takes a lot of courage and bravery to ask for help. But let's leverage those strengths that we know are already down in each of you, because you raised your right hand to serve our country and our nation. So we already know that you're brave and courageous. But when you get here, you will be welcomed and received and cared for in a non-judgmental and supportive way. we take care of all veterans.
Very well said. Very well said.
I
And,
agree. I have one small thing to add, which is related, basically what you said, Paula, but treatment is available, and we absolutely have treatments that work. We know that. There's a lot of research that supports the treatments. And I am proud to share that we offer those evidence-based treatments at VA Maryland Healthcare.
So if veterans, I'm going to put this in the comment, if veterans want to connect, is there a specific numbers, like a telephone number they can call?
I
meant to the VA Maryland healthcare system.
Yeah, they can call the main number, 410-605-7000. Or for Baltimore, or 410-642-2411 for Perry Point.
And if they're in crisis and it's in the middle of the night,
they really need to call the Veterans Crisis
988 and press 1.
Yes. And always, if it's an emergency situation, 911.
Absolutely. Absolutely.
And go to your nearest emergency room. So if you live way, way, way across town, you don't have to drive way, way over. If it's a life-threatening emergency, go to the nearest emergency room to get support.
Perfect.
All righty. Well, I want to thank you ladies so much for talking about National Depression and Mental Health Screening Month with our viewers, our veterans and family members who watch and who can keep this information. The one good thing about streamed videos is that they can go back again and again and watch it, and each time maybe get something new and different out of it. So thank you both for joining me today and for sharing your wisdom and your knowledge and the services that are available to veterans. So
thank you so much for having us.
And yes, thank you.
Thank you everyone for watching, and we'll see you soon.